Well, that brings us almost to the conclusion of week 3 of the online seminar series. And to wrap up today's proceedings, the short lecture that I want to give you is on setting up your systems. Now, obviously, Myopia Action Month is all about taking action, all about taking all of this knowledge and putting this into practice so we can communicate, so we can prescribe, so we can train our team, do everything that we need to make this happen in practice. And so the intent of today's lecture is to really think about setting up practice systems and how you can make this a habit and how you can make this simple for yourself and for your practice team as well. Now, we've heard already from a variety of our premier and supporting sponsors of Myopia Action Month in understanding various products, treatments, strategies to help us put this into practice. Today's feature lecture was a lecture brought to you by EssilorLuxottica, one of our premier sponsors. And in that lecture, I spoke to you about innovations in myopia management and spectacle lens designs. Let's now move on to setting up our systems. Now, before we started Myopia Action Month at the start of September, we put out a Have Your Say survey. And the intent of this survey was to ask you a variety of different questions about your attitudes and your practices in myopia management, and primarily the support you need to make this happen in practice. One of the questions that we asked was, do you have access to any myopia control products in practice? And of the responses we had from all around the world, more than 50% of us had access to these treatments here. So dual focus soft contact lenses, MySight, was the most accessible treatment of the lot. Center distance multifocals were second, or all on equal pegging were center distance multifocals, dim spectacles, and orthokeratology, and atropine was in there as well. With about 20 to 35% of us saying we had access to these were the highly aspherical lenslet technology, Target Technology, a Holt Stellus lens, or the Quaternary Optics Visioneering Technologies Natural View. And then 3 to 6% of us had access to specific types of ortho-K products, such as Ability Overnight or Menicon Bloom, sight glass dot spectacle lenses, and 10% of us said we had other myopia control products. So interested to know what those might be when we were thinking about the spread of what's available and what's evidence-based as well. So we have access to products, almost all of us. A question we also asked is, do you have access to axial length measuring equipment in your practice? And interestingly, of the cohort who answered our survey, 55% said yes, and 45% said no. Of those who did have access to axial length measurement, around 30% had access to the Topcon Maya, about half as much to the Oculus Myopia Master. The biggest group was those using other instruments, perhaps biometers, which are just specifically dedicated towards measuring axial length and not combination or multifunction instruments as these. And interestingly, around 10% said they had access to equipment but weren't confident to use it. So it tells us that we have products and we have equipment to set up these systems for myopia management, but obviously there's support that we need to put this into practice. So in terms of setting up your systems, I'm going to give you 4 steps, 4 general principles that regardless of your setting and scope of practice, you can consider in terms of how this works for you and for your team. These are: number 1, educating your team to start the conversation with key myopia messages. Number 2, determining which treatments you will prescribe. Number 3, setting up processes for the myopia management handover between you as the eye care professional and the practice team. And then finally, establishing resources for the team to provide to parents and to patients. Let's go through each of these in turn. Now, the intent here is just to give you some food for thought. And so food for thought in key messages to start the conversation and simple ways that you can approach this yourself and support your team to approach these conversations is that myopia is these 4 things. Myopia is growing in prevalence around the world. It is a progressive worsening condition in children. It's important we explain that it will get worse. It's more consequential than just a pair of glasses, because we know there are these long-term eye health risks when it comes to myopia progression. And also we know that the short-term detriment of myopia progression is that children will experience less stable vision between their eye exams. So there are short-term and long-term consequences of myopia progression. But the good news story is that this progression is manageable with treatments available to slow myopia progression. So we can have simple conversations explaining these key points that can lay the foundation for parents and patients to understand myopia management. Then secondly, determine which treatments you will prescribe. Almost all of us had access to myopia control treatments and a variety of different options: spectacles, contact lenses, pharmacological options. So this little podium you can see over on the left of the screen comes from our Managing Myopia Guidelines Infographics, and I'm going to explore those a little bit later. But it's a way of communicating treatments, and the fact that we have a lot of treatments available to us that are very effective and appear to work similarly to control myopia. Essentially, the prescribing pathway is prescribe anything other than single vision where it suits that child and it fits your scope and setting of practice. And for me, as an optometrist, it makes sense that I would want to prescribe optical treatments first, because these provide the dual benefit of myopia correction as well as myopia control. Now, I'll show you a little bit more about these treatments a little bit later on. When you're also thinking about which treatments you're going to prescribe, have a think about, from a billing perspective, whether you might consider packaging these up, whether you might consider an approach where you are smoothing out the variations in cost so that parents can make a decision based on the treatment that best suits their child rather than based on cost. And if we think a little bit wider than just the treatment itself, if we're fitting a child with myopia controlling soft contact lenses, say dual focus MySight, which is that second little infographic there, or orthokeratology, which is the first, well, they're going to need backup spectacles. And if they're only wearing them very occasionally, single vision is likely to be appropriate. If they're not wearing the contact lenses full time, say in the case of part-time wear of MySight one day, then you probably want a myopia controlling spectacle. But let's think about the example of a child who is wearing contact lenses full-time. You could include within a package of their myopia control prescriptions backup spectacles, and also they obviously need solutions to clean their contact lenses with Ortho-K. Maybe they need eye drops if they're wearing MySight one day. If you've prescribed atropine as a primary treatment, well, that child needs vision correction. Maybe they will need progressive addition spectacles if they suffer any side effects. Maybe they need photochromic spectacles to manage side effects as well. And they need spectacles or contact lenses to see. So you can think about how these things fit together and if that's something that suits your practice. Obviously that varies enormously across the world. So it's a general principle to think about as it best suits your scope and setting of practice. Then step number 3 is setting up processes for the handover. And these are key questions that parents and patients are likely to have. So we can proactively communicate this information across the team, from the optician, optometrist, or ophthalmologist to the practice team, with the patient and the parent present, so that they understand the process. And these can be simple questions like this: how and when should the treatment be used? Are any breaks okay? We know with myopia controlling spectacles and contact lenses that we want full-time wear to achieve the best myopia control outcomes. What optical correction is required? This is especially important if atropine is prescribed as a primary treatment, because parents can think that that will fix their vision too. So it's really important that we explain the vision correction element as well as myopia control treatment. With optical treatments, the one treatment does both. And then what are the next steps? When's the next appointment? What is expected in the meantime? What are we wanting to do or to evaluate at the next appointment? This helps to orientate parents and patients to following through across the process of clinical care. And it can be helpful to prepare for key questions from parents. And these could be questions which are criticizing or questioning the validity of myopia management, or these could be questions which are positive and proactive and wanting to do everything that a parent can to help their child. So these could be questions like, is myopia control really necessary? Can't this be fixed with laser when he's older? These are questions that I've had time and time again in my consultation room. Is this treatment safe for my child? So make sure you're ready with responses to those. Proactive parents might ask, how will we know the treatment is working? What should I do about screen time? Because we're all talking about visual environment. Or what else can I do? So it's important to have information prepared and resources that you can direct parents to help them learn more. So these resources that we can direct parents to can take a variety of forms. They could be answers to these frequently asked questions, which might happen in person or on the phone or on email. Website information. This could be external websites like mykidsvision.org or directing to particular places on your own practice website. And hard copy information. If that's something you use, there's no doubt that in this digital age, patients and parents still like pieces of paper to take away with them, concrete information in that respect. And there's various options that you have to set that up, whether you're designing that yourself or using tools such as those we've made available to you at myopiaprofile.com. What are those tools? We are very excited to announce the newly updated version of the Managing Myopia Guidelines Infographics. Now, these have been wildly popular since we launched them close to 4 years ago, and we have updated them to a new messaging and a new look which fits with our new website. So our new updated version of mykidsvision.org and myopiaprofile.com. All of the information in the previous infographics is still current, but we've updated with some new treatments and some new understanding to make the messaging simpler, taking on feedback that we've gained over time. Now, there are two sides to the Managing Myopia Guidelines Infographics. This very colourful side is designed to guide you through a parent communication process. And this side here, which is in the blue tones, is practitioner facing. It's designed as a chairside reference that you can refer back to at regular intervals to help you understand various aspects of long-term myopia care. So just to take you through the elements of the parent communication process side, this is talking about all the things we need to talk about in a myopia management consultation. And maybe this is at each consultation, maybe it's more at the outset, but it's designed to guide you through. Firstly, we have visual environment advice. So we have our 2-hour outdoors rule, and then we have our near work rules. Our elbow rule to maintain a reasonable working distance, our 20-20 rule, and the 2-hour rule to limit leisure screen time after school, outside of school hours, to ideally less than 2 hours per day. This is advice that's useful for all kids with myopia, all kids at risk of myopia, and maybe all kids really, because parents are definitely looking for this sort of advice when it comes to screen time. The second panel is what are my options? And here, according to lots of other messaging we've had across myopiaprofile.com and in lectures that you may have heard me give as well, we've broken our treatments up into best, next best, and less effective categories. And this is based on evidence that we don't have clearly superior treatments than the others, but we do know some treatments which are less effective. And this is a simple way for you to communicate the efficacy of treatments by saying that the top tier of treatments will slow myopia progression by at least half. And you can read more about that on myopiaprofile.com. Thirdly, if you're talking about contact lens wear in kids, here are 4 very key messages to give parents and patients confidence in how successful and safe kids can be as contact lens wearers. So this is talking about safety, about the benefits, the psychological and functional benefits of contact lens wear, data on the low risk of infection, and also that children are generally swift to learn how to handle contact lenses. And then the final panel is talking about why myopia management is essential. We've got short-term goals and long-term goals, and this is important for approaching parents and patients to their level of understanding. So they understand the short-term benefits of more stable vision between eye exams for children, and then the long-term benefits of reduced risk of eye diseases across that child's lifetime. Now, the practitioner chairside reference is not necessarily for patient communication, although you could use it that way. It's more designed as a reference for you. And what we have here is, again, 4 panels, the first being myopia risk factors, for you to understand how these all feed in together to increase the risk of a child's myopia onset or progression. Secondly, we have some prescribing decision trees. Essentially, your first question is spectacles or contact lenses, because a child with myopia needs either specs or contacts to see. And then there are some questions based on individual patient factors, such as astigmatism and binocular vision, and considering side effects with atropine. The third panel is follow-up schedules as recommended by the International Myopia Institute Clinical Management Guidelines. So when you're initially setting up, establishing a myopia control treatment, these are the recommended schedules. And once a child is successful and safe and seeing well with their myopia control treatment strategy, we see them every 6 months according to the IMI recommendations. And then the final reference, perhaps the most useful one I would say in long-term care, is gauging success, understanding how much refractive change we should see per year based on averages. And there's a lot more you can read about this on myopiaprofile.com. There's also a little bit of guidance on axial length data as well, if you're using the figures rather than using software or growth charts, because there's lots of different ways to use that data. Again, lots more to learn and read about. So all of this can be found. These can be found to download in several languages from the resources section of myopiaprofile.com. And obviously this website is designed to help you with learning, with resources, with courses, and a whole host more. What I haven't mentioned yet is that the infographics have a companion parent-patient brochure. And so I know when I've been using the infographics in my practice that parents have put their phone and their keys on it and wanted to take it away, and I've said, no, that one's mine, but I've got this one for you. And you can draw on that and point to particular areas of the conversation that have perhaps been most notable for that child. So this is downloadable for free as well from myopiaprofile.com in a variety of different languages. Now, what we also have in the resources tab is this QR code sheet which directs parents to particular articles on mykidsvision.org. So if you've had a specific conversation about the childhood visual environment or Ortho-K or what is myopia control, you can direct parents specifically to that article just using their phone. So you can print that off or bring that up on your computer screen. And mykidsvision.org is designed to support that communication by enabling you to send parents somewhere that backs up your clinical conversations, that's completely evidence-based and is entirely independent. So there's a variety of different resources on there which are divided up based on the child's age, based on treatments, based on topics of interest. Have a look at that so you know how to use that best to help you. There are also how-to video guides which you can share on your social media platforms or on your website. There's a risk assessment, which is a short 5 or 6 question survey. We know a lot of our colleagues use this in practice, say in the waiting room, to help parents understand a little bit about myopia risk factors and to sort of start the conversation before the eye exam. And a brand new element on myopiaprofile.com, which we only launched last week in week 2 of Myopia Action Month, was our practice accounts. And within our practice accounts, we have our myopia management for the practice team certification course. So this has been set up in a particular infrastructure in the practice account, which is free for you to sign up to, which is designed to enable the practice team and a variety of people in one practice to sign in one account using individual PIN numbers and to complete this certification. So make sure you have a look at that and you sign up. You don't have to own the practice to have a practice account, but it's important that you do have understanding with your team and you are collaborating between the eye care side and the practice team side to make this happen. and this is freely available for you to access. Make sure you sign up in Myopia Action Month. If you are looking for training for yourself or for your colleagues or staff who are eye care professionals, then we have a variety of specialist courses, 2 to 6 hours in duration, on myopiaprofile.com. We've also launched this baby in week 1 of Myopia Action Month, which is called Myopia Management Made Simple. Free to access, again, throughout Myopia Action Month. 1 hour, over 100 scientific references, summarized into what you really need to know to take myopia action and to put it into practice. So this is for eye care practitioners. Jump on and have a look at that if you haven't already. At this point, I want to again give enormous thanks to our sponsors of Myopia Action Month who have made all of this happen. The online seminar series, these beautiful videos that we've seen of practitioner and patient experiences with myopia control treatments, these wonderful lectures that have helped us learn. This has not been possible without the support of our premier sponsors and our supporting sponsors as well. And what we're asking you to do at this point of Myopia Action Month is to make sure you stay in touch. If you haven't yet accessed the Myopia Management for the Practice Team course, if you haven't yet accessed the Myopia Management Made Simple course for eye care professionals, if you are yet to have a look at our infographics, if you have, download the updated ones. These are all designed to help you. And if you keep in touch with us through Facebook, LinkedIn, Instagram, or via email, you'll be able to stay right on top of all of these elements that we are putting together to help you in practice. Thank you so much for your attention on week 3 of the online seminar series. I hope that you've learned a lot. You've got a lot of food for thought to think about how you can take myopia action in your practice. Thank you.